Congratulations to you, Dr. Fabi, on being the 2015 City winner of San Diego. How do you feel about it, Doctor?
I feel honored that my colleagues have been able to voice their opinion and vote for me as a doctor's choice for the city of San Diego. There's not many websites or outlets for us as physicians to vote and credit our colleagues, and I appreciate that the Doctor's Choice Award allows for that from my colleagues.
You have received great reviews from your peers in the industry. What drove you to take part in Doctor's Choice Awards?
I feel very fortunate that I received such great reviews from my peers. The reason I chose to participate in the Doctor's Choice Award is that, again, there are not that many outlets for physicians to get to vote and endorse their colleagues. And so the Doctor's Choice Award is the only real outlet that I'm aware of that allows my peers to comment on my professionalism and on my knowledge. We have many different outlets for our patients to be able to do so, but there is nothing like another colleague to endorse you. Having gone through the same rigorous training, they recognize and know when another physician has bedside manner as well as the knowledge and credibility to be an outstanding doctor. And so for that reason, I chose to participate in the Doctor's Choice Award.
Describe your experience and skills, Doctor.
I practice 100% cosmetic dermatology, and in order to get to this point, I did 4 years of medical training at the University of Illinois in Chicago, and then I stayed there to complete my residency in dermatology. I moved on to do a fellowship through the American Academy of Cosmetic Surgery, specifically in cosmetic dermatology, in order to become an expert in a field that has really become its own field or subset in the space of dermatology. This fellowship allowed me to get hands-on training in over 50 different lasers, as well as an extra year of experience in injectables, including fillers and neuromodulators, as well as liposculpture and sclerotherapy. Since that point, I've become a trainer for companies like Allergan, Galderma, and Merz, now having trained over 50,000 physicians worldwide, having spoken in over 25 different countries, and given over 300 lectures.
What are the key challenges in the field of cosmetic dermatology today, Doctor?
One of the key challenges that we face in cosmetic dermatologists is that there are a lot of people that aren't as qualified or trained in medicine, let alone cosmetic dermatology, to be performing some of the procedures that they're doing. Estheticians, who essentially have probably only 40 hours more than a hairstylist, are able to actually inject fillers that can have detrimental effects to patients, since there are many arteries in the face, and this has even been found to cause blindness. And so it's just appalling to me that there are certain people that are injecting and treating people with no real medical training and are being sought after just because of a difference in price. And so ultimately, cosmetic dermatology doesn't only require a medical training to understand the different pathophysiologic changes that are occurring with the aging face and body, but also requires a level of artistry, since there is more than just injecting the nasolabial fold in augmenting or in enhancing the appearance of a person. It takes a certain level of anatomy knowledge as well as a certain level of artistry to know how to combine this knowledge in order to achieve the best outcomes for our patients, so that ultimately our patients look natural and don't perceive this field as something that's going to make them look cold or done.
What new treatments are you doing right now that you are excited about, Doctor?
So I'm very excited about Kybella, which is an injectable that was approved over a year ago to reduce submental fat. This is a drug that I was actually an investigator for and have been injecting since 2011. And it's nice to be able to offer my patients something that takes as quick as 2 minutes to inject at the bedside that can offer them long-lasting results in overall the way they look, how young they look, and their overall profile and chin and jawline tightness. I'm also very excited for many of the different lasers that we have available, specifically the clear and brilliant Chromea. We're finishing up a study right now in that we've been treating patients that are darker skin types, both Asian, Indian, Hispanic, and have found no one to develop any darkness or hyperpigmentation after treatment, while successfully treating both photo damage and melasma, which is always something that is so tricky for us to treat for our patients. And so these are just some of the exciting things that we're offering here at Cosmetic Laser Dermatology, and that I'm excited to be able to offer my patients.
What makes you effortlessly maneuver between roles of dermatologist, speaker, trainer, and author, doctor?
So I don't effortlessly maneuver between all of these roles, but I will say that having a passion for both education as well as caring and treating patients and making them look and feel the best for their age allows me to be able to jump between all of my different roles without much aggravation and being very enthusiastic and excited about doing this. So I think ultimately it's having a clear understanding as to why you're doing what you're doing and having a passion for that that allows me to perhaps do something that may appear effortlessly, that may appear effortless, but in fact is not effortless. It does require some bit of energy, and sometimes I am a little bit tired, but I am so grateful that I am able to touch so many lives, both as patients as well as with my colleagues.
Do you believe collaboration and networking among doctors through services and programs such as Doctor's Choice Awards play a significant role in the success of modern medical professionals?
I think it's wonderful that we have platforms such as the Doctor's Choice Award that allow us to network between specialties. Classically, after medical school, we usually just aggregate with our own specialty or our own local societies. But this type of platform allows us to network across different specialties, since many physicians still face similar trials and tribulations regardless of their specialty. And so this allows us to be able to network and share and disseminate information that we otherwise may not be able to do.
What are your future goals and objectives, Doctor?
My future goals are to advance the discipline of cosmetic dermatology. We have so many different technologies that I think we can continue to use and apply for different indications, as well as many injectable treatments that can perhaps one day allow us to achieve natural aesthetic results for our patients without them having to undergo a facelift, which more and more patients are not doing anymore. And so my passion, my goal is to really advance the field, both by doing research as well as by educating and empowering my colleagues as well as my patients about the possibilities.